Hi, everyone. Today we're going to take a look at cardiovascular disease, and this will be a very um, higher level overlooking picture into the different cardiovascular diseases that are more common. So let's take a look. The first slide we want to talk about today is the pathophysiological manifestations. These are some characteristics of heart disease or cardiovascular disease, and sometimes they are indeed a condition themselves, or sometimes they lead to other conditions, but they're usually related to, for example, a thrombus is a blood clot that's often related to a myocardial infarction, but not always. It could be something that shows up like a deep vein thrombosis. So some of these terms, aneurysm, just they're problematic with the cardiovascular system. Specifically, an aneurysm is it's when we think about the blood vessels thinning, and we think about some main ones like the aorta or the abdominal aorta, the AAA. And usually this results in a bleed that is out of control and then may cascade into other problems. There's a little bit of an idea about mixing of blood, and that's called cardiac shunts. They're malformations, typically birth defects, and it is not desirable. In an infant, it's okay, but when you're older, your heart needs the chambers need to remain separate and functional on their own, so you don't mix oxygenated and deoxygenated blood. That's problematic, which I'll talk about more a little bit later. Again, these are just some terms. Embolus is any substance that's circulating in the blood that shouldn't be, that perhaps gets lodged. You could think of a fat embolism in this example. Sometimes those occur with fractures. Anyway, we're also going to generically give you an idea and look at cardiac enzymes and proteins that basically are measurable quantities that can tell you something about the whether or not a person's had a heart attack or when that might have happened. But there's time restrictions on that because they're released upon injury to the heart muscle. Stenosis is a common term that we use in anatomy and physiology that represents anything that's narrowing when it shouldn't be. It could be a nerve, an area of the foramen or something where the nerve goes through that can narrow and cause a pinching nerve, or in this case, arteries are what we think about when we think about stenosis, or valves as well. Thrombus, as I already mentioned, the blood clot, and in general, valve incompetence. You have valves in your heart that act as one-way paths. It's kind of like in plumbing in your house, there you have check valves. And check valves keep water going in one direction, and if there's back pressure, it prevents backflow into the other where it came from, where the water came from. Same with your heart. Blood's supposed to flow in one direction, but as you can imagine, if it's not working, you'll get what's called regurgitation and indoor pooling, and the blood actually goes the wrong way. So those are just some terms, but let's take a look at an aneurysm. There's several different types, and basically it's the wall thinning and then it starts to bulge. Most likely when you hear of an aneurysm, it's the fusiform type that's looked like a big bulge, but there's some that form a pouch and some that have sort of separation of layers, and creating like what's called a false lumen. Lumen is basically the cylinder path, the hole that everything travels through. This is the lumen in here. And finally, there's these pulsating hematomas that are a result from trauma that are mistaken for abdominal aneurysms, but they're really false. Regarding aneurysms, there's several different types, and like I said, most of the time we're thinking of a weakened arterial wall. There's abdominal, thoracic, cerebral, even femoral and popliteal, which is related to your knee. Abdominal, I'm sorry, is the one you probably are most familiar with. And then atherosclerosis can be a contributing factor, can make that wall weakened and damaged, but other risk factors like trauma and COPD can all contribute to the weakening of these the arteries that we're talking about here. And as a result of some of these problems, when you have an aneurysm, they could rupture, or there can be an obstruction of blood flow, an embolism, and at the end of the day, there's going to be diminished blood supply. You could also imagine if it's an aortic, you have your aorta that comes out of your house and it goes down your thoracic and then to the abdomen. And when the abdomen ruptures, there's a lot of pooling of blood, and you can also be looking at loss of fluids at that point, and it's an emergency situation. But you can have a small one in your brain, and that could lead to a brain bleed as well. Hopefully, none of those things come true. All right, shunts. Again, we talked about that as being a mixing of blood between the chambers. In adults, it's not good, but it's okay in childhood. But if there's think about the flow from the heart, the left ventricle pumps your blood to your extremities, and the right basically takes deoxygenated blood and returns it through the lungs. And so if there's a left to right shunt, blood is there's a hole in your heart, basically a congenital defect flowing from left side to right side, you're going to get oxygenated blood going back. I don't know if you can tell which side I am, but this is my left side, and you're going to get oxygenated blood that's going back into the right side, and that increases the pulmonary blood flow that kind of leads to what we call hypertrophy, sorry, of pulmonary vessels, making them bigger than they should be, and eventually that can result in right-sided heart failure. Right to left, we call that the tetralogy of Fallot. It's the same concept, except we're adding deoxygenated blood back to the left side, and that is usually results in some kind of cyanotic condition where there's not good oxygenated blood, and so the person becomes cyanotic. The tetralogy of Fallot, the narrowing, basically, that's the narrowing of the valve between the heart and the lungs, and it's called pulmonary valve stenosis. There's that word. Or it could be a hole between the bottom chambers called ventricular septal defect. But anyway, it's shifting of the body's main artery can also cause this. This is the third characteristic, and then thickening of the right lower chamber of the heart, which is called right ventricular hypertrophy. When those four things happen, it's usually it's rare, but it happens, and it's leading to some of the shunt problems, and that we've been talking about. And that's when they all come at once. It's not fully related to genetics, although there's some familiar trends, and there's a few genes. It could be a chromosomal issue that malfunction during reproduction, but environmental toxins and maternal medications, there's no good reason for connecting this with a genetic disease, but maybe we just don't know that yet. So keep that in mind. All right, an embolus, one of the most famous ones that you think about is a DVT, a deep vein thrombosis. And when you have, if you keep in mind where the venous blood is returning to the right side of the heart, and so that's going to go through the lungs. So this makes sense if it's coming back from the veins to up to the heart via the right side, the pulmonary side of the pulmonary system is going to be infected because that infarction, the clot, the emboli could travel to the pulmonary to the lungs and cause what we call, sorry, I'm stumbling, a pulmonary infarction on the right side. So that's when that's what DVTs are most concerned with, is that traveling to the lungs. And so they also may originate from an artery on the left side of the heart. And any one of these cases, it could contribute to arrhythmias or valve disease, myocardial infarction, and heart failure. And from there, it would travel to the extremities because that's where the left side is working. And so you'd be concerned about it traveling to the muscles or organs, kidneys, brains, and other extremities. In a ischemic infarction is what we'd call that. Partial block is basically what that means. But anyway, you don't want to block your muscles or your organs either from their blood supply, because then you're going to lead to tissue necrosis and possibly organ failure. And in the case of like an infarction in the muscle is very painful and the tissue will die, leaving you with a limp or something of that nature. Similarly, a thrombus is the same sort of thing. It's an emboli that we call a clot. And there's a Rocheau's triad. When you have three things that kind of go wrong could lead to a thrombus. You could have some injury at the epithelial layers of your vascularity, and you could, as a result, have abnormal blood flow or hypercoagulability. All three of those things, that's well, when a blood clot is most severe or most noticeable. You can also have the ability to not have the triad, but when we think of a DVT, that's usually what we're thinking of in this case, where all three of these things are occurring. All right, so cardiac enzymes are a little bit complex, and we're not going to go into the deep dive and issues with this, but I think to me the ones I know the most about are troponins and myoglobin. Those are proteins that are released in response to cellular injury. And you can see this is a timeline, and here are the main players. The troponins are the very most reliable markers because they are specific to cardiac muscle. and they're released early in the process to indicate there's a heart attack. And so if you're deprived of oxygen, as we've talked about before, you're deprived of ATP, and then you start to get the cell membrane becomes damaged, and it causes enzymes and proteins to leak out. This leads to the damage also occurs. The heart is trying to, these proteins are coming out because they're trying to fix the heart. And anyway, without the ability to have oxygen delivered to our cells or tissues in our cells, we lose the ability to maintain integrity of those cells via the cell membrane, the ATP pump, uh, the sodium potassium pump that is driven from ATP, sorry. And so then everything sort of breaks down in what ends up being uh, systematic organ failure. So anyway, just bear in mind that it's the muscle tissue is being damaged severely, and your body does send out its army to try to fix them, but they don't always work. Obviously, it just depends on how fast we can get some relief. That's why timing and knowing about how old the heart attack is very important. All right, we've got some valve incompetence. This is a big general idea that the valves could leak or they can become constricted and have what we call stenosis. They could, um, they should open and close in a fashion that is suitable, but if there's stenosis, they might not be fully open and they might not be able to fully close, leading to the leaks. When blood goes back, it doesn't stay in its check valve position. The valve is leaking and blood's going the opposite direction it's supposed to be. It's not going a lot. We think of those, we term those as murmurs, and there's not, the term for that leakage is called regurgitation. It's the swishing sound that you would hear if you hear a murmur. And again, it's due to those weakened valves. But varicose veins are similar. They're in your periphery, and there's little valves on the veins. And when those valves malfunction, you get the pooling of the blood in the knots that you see with varicose veins. This was common in my family. Fortunately, I do not have that. So anyway, the blood becomes sluggish and clots can form. The blood flow is disrupted. And the other thing that can happen that we'll talk about more as well is the heart, that regurgitation really makes the heart work harder than it needs to, and that leads to hypertrophy. That could cause the cell chambers to stay full of blood and not get rid of it, and they start to dilate. And typically, the mitral and aortic valves are the ones that are most common that we see, but that could be in any of the heart valves. And again, the term stenosis reduces when the blood narrows, they don't open, they have reduced blood flow. Hypertrophy also results from that because of the increased workload. And that's what the term for hy hypertrophy that we often use is cardiomyopathy, which we'll talk about later. And all of this eventually can be problematic in the sense that your heart could fail. All right. This is just an image for you for your own edification. You can see a mechanical heart valve. We have these tendonae, chordae tendonae that are part of what helps a valve open and close them. I think this is wild, but this is what a mechanical valve look like. We can also use pig valves, and we can also do this open heart or, open chest surgery. And then also in the cath lab, there's different versions that we can do with heart valve repair. Currently, you see that there's a tricuspid valve here on the right ventricle, and then your left ventricle is the mitral valve. It's bicuspid. Anyway, my dad actually found out recently with all his heart troubles that he has both of his valves are bicuspid, which is kind of weird. The lunar valves are a little bit different, but I'll trust that you have that in anatomy and physiology, and we'll kind of move on. But I do want to show you, this is sort of a surgical replacement of the heart valve. It's kind of cool. This would not be in the cath lab, but they can deploy some of these right in the cath lab. It's kind of cool. And this is actually a donor heart that I think is pretty cool, waiting to, I just wanted to show you this. This is a new contraption that basically can hook up the heart until it's ready to be implanted into a donor. It just happened to be where it's on the slideshow, but if you're a little wiki, you might not want to look, but there's some blood involved. They hook that heart up, get it beaten while they're waiting to transport it. It's pretty cool. Uh, it's not often we get to, other than TV, it's pretty cool to see a beating heart. They're stitching that in until they get ready to really do the transplant. Anyway, I thought that was kind of cool. All right, let's look at the AAA. If you paid any attention, abdominal aortic aneurysm is usually it'll be referred to as an AAA or AAA. It's a sometimes it feels like a pulsating. There's a pulsating mass in the periumbilical area, and you will hear these whooshing sounds during systole, the bruit sounds. There's flanking pain starting from the lumbar, but it radiates to the flank, I should say, and you'll have a diminished peripheral pulse. So keep that in mind. You might want to take the pulse a little bit higher, but it's not. You can think of blood distribution. It's not getting down to the extremities. There's also weakness, sweating, and tachycardia. And if that ruptures, you're going to have you see hypertension from the hemorrhage, hypovolemia that we talked about. It's going to have a complication, as I've already mentioned, where we have restricted blood flow to other organs, perhaps an embolism to the peripheral artery. The treatment is pretty cool. They can do a surgical graft repair, and you also want to treat the underlying problems, whether it's cholesterol, hypertension. Those will show up everywhere. If you're going to encourage your family members to take care of their heart health, managing cholesterol and hypertension are just the two biggest killers out there, and we kind of tend to ignore them because they're silent. Anyway, and there's also beta blockers that are used to lower blood pressure and heart rate. They do this by blocking the action of epinephrine. And so adrenaline is needed, epi is needed to stimulate the heart. There's receptors on the cells of the heart that take this in and then encourage the heart rate and blood pressure to rise. But if we block those receptors, we can block the action of that and help lower the heart rate and the blood pressure. It's medication that's used commonly, as you know. All right, let's look at atherosclerosis. That's another one. It's kind of along the lines of talking about the cholesterol conversation. Cholesterol contributes to atherosclerosis, but there could be other reasons why the blood vessels are hardening or being damaged. You could have plaque formation in the blood vessels, blood clots. You could have damaged blood vessels, and you get a clotting. The cascade of clotting starts with platelets, and they start to accumulate, and some of that plaque could break free and become an embolus. But as you know, it's a leading cause and contributor to cardiovascular syndromes and problems, ischemia, the blockage, and the angina pain. Um, Myocardial infarction, the heart attacks, strokes, and peripheral artery disease are all associated with atherosclerosis. Um, and anyway, the contributors obviously are cholesterol, but smoking, diabetes, smoking is really hard on the blood vessels and the vascularity of your body. Diabetes is also hard on it. Hypertension is hard. It's constantly beating on your blood vessels, and chronic inflammation actually too. So you kind of need to manage your stress and inflammation because that just inflammation is damaging to cells and including your vascularity. All right, the big one, myocardial infarction, and we all know what that is. That's our big old heart attack. What do we have to say about this? You have four main arteries. Your heart is a muscle. It needs to also exchange gases and have nutrients to feed that muscle. It's freaking awesome. It beats all the time for your lifespan. It hardly, um, it's amazing that it does it as well as it does. If you put a pump in your car or in your house, you're lucky if the lifespan of a mechanical pump is 20 years. Here, your heart does it every day, every day, every day, year after year. It's pretty cool. But if you have a problem where you have a blockage and you have there's kind of different stages and you can see the corresponding EKGs and if you have a just a ischemia where it's not quite fully blocked you see ST segment depression and T wave inversion. I'm not going to go into big details on this, but you can kind of see where there's injury, there's an infarction, and when it gets pretty bad. So these things are read by professionals to sort of see what's going on with the heart as a result of the blockage. But you also want to do the EKG early and cardiac enzymes early to see what's going on. Again, there's four main arteries. What's really cool though is that you can your heart can sort of not remodel, but new blood vessels can form to try to take over the load of an artery that's blocked. And so there's some of that that's kind of cool. But anyway, it's going to classically present as chest pain and left arm pain. For women, there's different symptoms, and some guys too have upper back discomfort. That was a big thing that my dad had that he ignored. He said his shoulders just felt so heavy and so uncomfortable in the fullness in the neck. He described some of those. Yeah, I don't know, just keep in mind it's not just the classic symptoms because he didn't really have those and we missed it. And now his heart muscle is damaged. So if you cut off oxygen to the heart, as in any muscle or any tissue, there's going to be necrosis and damage. And this will impact that stroke volume and the ability to eject that blood from the chambers of the heart as it needs to. It can't form that contraction. The contractions are weakened. The muscle is weak. It just can't fire like it should. Other complications include arrhythmias and instability in the ventricular. Like my dad has that. He has ventricular tachycardia. Basically, he can't empty, and so his signal comes from the sympathetic nervous system is saying, "Hey, come on, increase the heart rate. Let's get that to that ventricle. Let's get it going so it can pump out." And so he ends up with very dangerous arrhythmia as well in his tachycardia in his on his ventricles. Anyway, heart failure and death are obviously outcomes of a heart attack that we don't really want to talk about, but heart failure can be an eventual path and death, but heart failure can occur under a lot of complications with other heart disorders that we talked about in another lecture. All right. Anyway, this is just basically a brief introduction to some of these different stages where, here's your normal heart, and this one is where you have a narrowing artery that's going to lead to the ischemia, and not full on heart attack at this point, and it might cause a little bit of pain and called angina. But anyway, if you get a little bit further block, it can, where your blood supply is cut off, it's going to, there could be a thrombosis there, and you could see how the heart sort of dies in this area, and that's what we call the myocardial infarction. And then there's some recovery, like I talked about, where there's some new blood supply that's laying down. But take a look at that. All right, this is a big page, but it's pretty good. It kind of shows the pathways of the things that are going on during a heart attack, and the even including the um, where the coronary blood supply is affected, how the therapies are used too, like when we use aspirin and when we use beta blockers and bed rest and nitrates. Nitrates are nitric oxide is used to vasodilate. And so this is a great summary, excuse me, of the things that can occur during a heart attack and kind of how we treat it. So just use it to kind of enhance your knowledge. All right, a little bit of continuation. As I mentioned, some of the treatments include trying to reduce clotting. We do that with blood thinners and aspirin. We also are going to try to vasodilate and or reduce constriction so that we improve the blood flow and the blood pressure. It gets tricky when the heart starts to be damaged in more ways than one to manage blood pressure. But in general, we need to, usually there's an ACE inhibitor or an ARB or something given to um, take some of the water out of the working with the kidneys to kind of balance the water so there isn't as much force and it's a little less volume in there to reduce the volume to vasodilate. Also, reducing blood pressure by blocking adrenaline or epi. It's the same thing, just different terms. So beta blockers we talked about. We also want to reduce lactic acid buildup and increase oxygen so that we don't get acidic, as we've talked about. Reducing pain, you use nitroglycerin. It kind of relaxes blood vessels. Reduce the arrhythmias, going back to the beta blockers. Diuretics, to try to, if there's congestion, if heart failure is occurring, you want to get rid of the water that's not being dealt with. And that's going to be one thing that's going to impact the blood pressure. So, with my dad, his blood pressure is really hard to manage because he has so many problems. It can be low or high. It's not stable. And then, you can increase blood flow through stents as well. He's got stents. He's got a lot of those. Angina is kind of just looking at the different things where you have some plaque building up at the beginning in the artery, and then the angina is when it gets a little bit tricky for the blood to get through the artery. There's some pain with that. It's not a full block, but a heart attack is when the plaque cracks and the blood clot blocks the artery, and then an area of the heart is deprived of blood. STMI, STEMI, and NSTEMI are just different ways to describe blockage of a coronary artery. And you don't have to know much about it, but your book talked about them, so I wanted to bring it in. STEMI is usually caused by complete blockage of a major artery, and an NSTEMI, it's usually caused by a partial blockage of a major artery or of a smaller branch of an artery. All right, I used to refer to this as peripheral artery disease, but they're calling it now arterial occlusive disease. It's the same thing when the arteries in your periphery are occluded or blocked. Atherosclerosis, the narrowing of the arteries, we've already talked about. In that case, you're getting some fatty deposits from cholesterol or whatever, triglycerides that are forming in the lumen, and the lumen narrow, and then it restricts the blood flow. There are complications that result when the periphery of your blood, not just talking organs, but thinking more of your distal extremities in your skin. And it's hard when blood flow is lacking and oxygen and hypoxia are occurring. There's skin ulcerations and gangrene, perhaps stroke, embolism, and some necrosis from constant um, uh, partial blockage for your arteries. Obviously, the underlying cause are your favorites, cholesterol, lipids, and hypertension. And sometimes you'll treat it. I should have had treat the underlying cause, which are the first three, but you can also have embolectomies and antiplatelet therapy, aspirin stents. We sort of talked about this. All right, the big one, cardiac arrhythmias, is basically your heart beats. It has an electrical system that makes it beat to help send signals to the muscle cells to fire and to contract. That is largely controlled by specialized cells and the movement of ions that we've been talking about through channels. Perhaps most famously, I would say the big three players are sodium, potassium, mainly potassium, and calcium. Anyway, um, things that contribute to disruption of a normal heart beating is acid and base imbalances. There's cellular hypoxia someplace, connective tissue disorders like lupus or Marfan's and other connective tissue disorders, electrolyte imbalance, hypertrophy, myocardial infarction. You'll see a lot of things that overlap. But so when your heart muscle is damaged and certain areas can't get fired to contract, you might get a weak contraction, or you won't get a full synchronized. Think of this as a synchronization of the contraction. There's other contributors: renal failure, drug reactions, diffusions from cancer, infections, hemorrhaging, infections of the pericardium. It just goes on. So let's look. There's two basic things that happen with arrhythmias. You can have a place where your electrical system is blocked or where it's misfiring and it needs ablation. You could have both of those situations going on if you're my dad. But anyway, there's also other things. Like I said, we talked about if there's changes in normal ion exchange mechanisms. These are your cholemias and whatnot that we were talking about earlier. Aging and other defects can cause cardiac arrhythmias. This is something that I see in my head all the time. This is just really good basic understanding of how the electrical conduction system works. Up here at the top is the sinoatrial node, and you can see it spreads the impulse to the atria. Then it goes to the AV node, and it spreads it to the ventricles. This is the bundle of His down the center, and then it goes to the left and right bundles. And this is what forms a coordinated heart contraction. I love this video because it overlays also onto a heartbeat, which I think is pretty cool. But my dad currently has a blockage over here. If you see my mouse, I'm not sure if you see it, but it's on the left side blockage. So this part of his heart is probably damaged from a heart attack that he didn't know he was having because he didn't have the full symptoms in his head of what was going on. And he was out of the country he was out of the state when this happened. So we couldn't talk to him. He was trying to be stoic. Long story short, in addition to his heart muscle being damaged and not able to eject the volume that it needs to eject, it's not getting the signal at this left area to do that. So currently he has a defibrillating pacemaker, and they want to add another lead. He's going to have that next week, actually, not that it matters to you guys, but they're going to add another lead here to try to get this contraction, the signal to be generated through the pacemaker, because right now his heart is not beating in a synchronized way. So that's probably also impacting his ejection fraction. Here's some different, the main rhythm issues that we see in arrhythmias. where you just see that it's different than it's not, it's more irregular, I guess I would say. Then you would have a slow heart rate and a fast bradycardia and tachycardia, atrial fibrillation and ventricular fibrillation. These are just really simple ones, but the complications, as we've already mentioned, sudden death, you got to get the heart back into its rhythm, myocardial infarction and heart failure and an embolism, a thromboembolism. All right, cardiac tamponade. They really literally got the name for tampon from this. It's when the heart fills up the pericardium, the sac that the heart sits in, fills up with blood, and it compresses the heart and it stops it from properly beating. It's just smothering it in a bit, if you will. And they need to do a procedure to go into that space and take the blood off. They withdraw the fluid, or they take the fluid off of that of the pericardium where it's accumulating. This is a normal heart. You can see the pericardium, and then you could see it also compresses, makes breathing a little bit trickier because it does compress onto the diaphragm, as you can see here. But you can see how the wall of the heart, the pericardium, the membrane is filling up with fluid and is larger. It's, I think of this as something that happens as a medical emergency, and it's usually trauma related, but not always. All right. One of the big ones is cardiomyopathy. Cardiomyopathy is basically a general term for any time that the heart enlarges. And that it's basically hypertrophy is when the term that we use to describe when a heart enlarges. And sometimes it's the chambers enlarge that we've talked about, where the chambers become dilated. It's called dilated cardiomyopathy. You can see it right here. Sometimes it's called hypertrophic cardiomyopathy, and it's basically there's the ventricles right here, or the septum you can see gets larger and thickened, and the heart again doesn't beat, and it causes it to enlarge. It doesn't beat well, it does beat. And finally, there's the third category is called restrictive. There's a few others, but these are the basic, where you have you think of this with certain diseases like amyloidosis or sarcoidosis, where there's inflammatory player involved, but you still see the septum of the heart um, uh, kind of thickened as well. So know the very basic differences between these cardiomyopathies. And the last one I would like to say is that there is such a thing as two things that I'd like to mention. There's such a thing as capture myopathy, like for animals, if you capture them, they can have such a reaction where there's so much adrenaline throwing through their system with that fight or flight response that it's like their heart becomes overrun by these catecholamines, and they cause heart damage to the muscle and death. Unfortunately, because it's like rhabdomyolysis. It's like rhabdo of the heart, basically, because of this overload of adrenaline. The same thing has been observed. You see it. I should have shown a picture of it, but it's similar to broken heart syndrome. You can really die of a broken heart, but I didn't put a picture up there, but just keep that in mind. They're cardiomyopathies, basically. All right, there's a situation where you have the narrowing of the aorta, and this is often associated with Turner syndrome, which we talked about briefly in our discussion of genetics. It's when instead of getting two X chromosomes, one from your mom, one from your dad, as a female, there was non-disjunction during meiosis, and you only got one. And it's a congenital heart defect. But it was in your book, you can read about it, but I kind of wanted to make the genetic connection. All right, coronary artery disease. Keep in mind, you have peripheral arteries and coronary arteries. Your heart has its own blood supply. It's actually the only organ that makes its own blood supply. And so you can see, again, some different pictures of coronary artery disease. It's similar to what we already talked about. It's the same sort of thing with the myocardial infarction that we talked about. So I'm not going to spend a lot of time. It's the same idea, same pictures. Um, Endocarditis. This is not a good one. You can see here, there's a heart valve here. Basically, if you get the reason why blood infections are so dangerous, we had this question come up in class, is because the bacteria then are traveling everywhere, and especially through your heart. and this can cause a problem with your valves. They start to adhere to the valve. It's just a great place for them to hang out and grow, and they form this thing called the vegetation. It leads to inflammation, tissue damage of that valve, and it could also spread to other parts of the heart. It's pretty life-threatening, and usually they do a central or a PICC line, and you administer antibiotics for like 6 or 8 weeks, something like that. So anyway, that's endocarditis. It's a infection of the heart, and it's usually from a bacterial, a blood infection. Heart failure is the big one. Yeah, so anytime your heart is not gonna, everything contributes about to heart failure. And this is a list of them: cardiomyopathy, myocardial infarction, AFib, valve issues. All of this can cause the heart to fail. When the heart fails, it does not get the blood to the lungs, into the systemic areas as effectively, and it just hangs out in the ventricles and the atria, and it causes, if you have diastolic, you have stiff and thick chambers, the heart can't fill properly. And if you have systolic heart failure, the chambers are stretched and thin, and the heart can't pump functionally. There's a lot of ways you can get to heart failure, a lot of ways you can describe it. But there's left and right-sided heart failure too. Basically, one of the things that we talk about with heart failure is if you imagine your left side failing, which that's where I'm pointing to is my left side, that's distributing blood, that left ventricle that's pumping blood out to the extremities. If that fails, the blood pools, and it pools back this way, and you'll get the congestion in your lungs. Conversely, if the right side fails, the right side's supposed to go to the lungs, it's going to get backed up and it's going to pool into the extremities. So this is where you see the congestive part of heart failure. Um, yeah, here's another way to look at it. And there's some interactions with the kidneys, and don't worry too much about this one. Just bringing kidney disease in there a little bit, but let's skip that for now. Hypertension is the big one. So one thing that you can do, you're putting a lot of force on your blood vessels. You're making your heart work harder. And this is silent. It doesn't kill you right away, but that damage, it's a co-contributor to about everything that we've talked about already. So what you see eventually that could cause problems, and eventually does, is you can have all that increased pressure, having the wear and tear on the heart, but you can damage the blood vessels, and from that increased pressure, and you can get platelets and clots that can lead to necrosis of those blood vessels. Medication, it's pretty simple. There's different ways to treat water issues and hypertension. They don't have them all in here. We don't have the beta blockers, so this is just something that's not fully important to pay attention to. These are other classes in general of how we treat different heart conditions, different medicines. It's kind of something that we've already talked about, but don't worry too much about this. We didn't talk much about foxglove and digoxin, but we could, but that's enough for now. So all of these images I'm not using to sell this or anything, so I don't have the copyrights to them, but I'm using them under fair use. And I hope this was helpful. Thank you.